Senator Roberts about the safety of his daughter hanging out at the beaches in South Carolina was an affirmative. There's no issue whatsoever. So to the 25 million or so tourists who are looking to descend upon the beaches of South Carolina, please feel free to call it your home. As we are looking, thank you all for taking the time to be here this morning as well. One of the things that we know about South Carolina is that it is in fact the home to the Aedes aegypti mosquito. The real question that I have, at least the first one, is what can we expect in terms of local transmission in the Southeast, and what is the CDC doing to ensure that states and communities are prepared for the possibility of a local outbreak? What's that coordination look like?
Yes, 13 states have the Aedes aegypti present, and 31 have the Aedes albopictus, and both of those mosquitoes can
Who names
carry.
these mosquitoes, by the way?
Good question.
I wish they would stop.
Yeah, okay, right. So one of the aspects of the supplemental request is to really reinforce what needs to be done in those states to support state and local government to work across the spectrum with mosquito control, with surveillance and lab detection, and with communication and outreach, particularly to protect pregnant women.
One of the questions, as we think about the, hopefully, the very remote possibility of anything that looks like an outbreak in the Southeast, and specifically in South Carolina, is that when I talk to my South Carolina officials, they specifically tell me and tell us that the mosquito in question is located in one county, whereas looking at the CDC map, it appears that perhaps it's in multiple counties. Can you talk to me about what I can share with my constituents back at home?
Yeah, this raises a key point that our maps are incomplete, and one of the key ways to control mosquitoes is to understand where they are. And so part of the resources would be to really map out where the particular mosquito's vector is resident. Even within a community, there can be hot spots, and we're particularly interested in for instance, in Puerto Rico, we're interested in hot spots where pregnant women may be frequently visiting, not just their homes, but the places they go.
Thank you, ma'am. And for anyone on the panel, are you looking into potential mitigating factors regarding the severity of the microcephaly? In the absence of therapeutics, is there any evidence that prenatal care, or nutrition, vitamins could have any effect on the severity of the microcephaly in babies born to women that contract Zika? That's the first question. And the follow-up question is there any hypothesis as to why some babies develop microcephaly and others do not once infected?
Those are really important questions, and the focus of the study that we're doing right now in Brazil, looking at women whose babies developed microcephaly and other women who were pregnant around the same time from the same communities whose babies were okay. We also don't know yet the full spectrum. It may be that microcephaly is one of the factors that this virus can cause, but that there are other parts of the spectrum. There may be milder disease or eye disease or other congenital defects. And we don't know about cofactors, as you mentioned, nutrition. People wonder about a number of things. And so we're asking those questions together with our Brazilian counterparts to try to understand that. I think the most critical thing we'd like to be able to learn is what the risk is, that if you do have Zika virus during pregnancy at different stages, what are the chances you'll have a normal baby? What are the chances your baby will have 1, 2, or 3 other problems, and whether early detection can do anything to improve the health of the child.
Sounds good.
This creates a very good segue into one of the questions that we just asked Senator Scott about research that you do ahead of time as opposed to just in an emergency response. The National Institute of Child Health and Human Development for years has partnered with Brazilian colleagues in prenatal centers doing research on antenatal issues, not necessarily microcephaly, because that hadn't been the target. But your question is highly relevant because there are so many issues that we still don't understand, as Dr. Shukert said. It would be really unusual for a virus that causes congenital abnormalities to have only one specific effect, namely microcephaly. So we're anticipating that as we study more, we're going to see other things that maybe microcephaly is the predominant one. We're already seeing a considerable amount of eye involvement that has already recently been reported. So we expect that we will continue to learn as time goes on.
Anything to add, Dr. Robinson?
No, I think they've captured it very well. Thank you.
Okay, thank you. Thank you, Mr. Chairman.